Hello, good evening. And this is my video on managing cardiac arrest. First of all, we need to recognize that the person is going into cardiac arrest. If he or she is, then we need to shout out at the person that, sir or ma'am, are you okay? Are you okay? Or then either we need to tap on their shoulder that, are you feeling okay? Are you okay? Then we need to check for the pulse and we need to check for the breath. This should not take more than 10 seconds. If the breath is not present, then we need to know that the person is going into cardiac arrest and we need to start CPR. But before starting CPR, we need to ask someone to call for help. Like very specifically, we need to tell a person, like the person is in a black t-shirt or a woman is in a black t-shirt, we need to tell them like a person in a black t-shirt, you need to call for help. And then we need to start our CPR very immediately. CPR is a cardiopulmonary resuscitation. How we will do it, we will put our one hand heel on the chest between the nipples and we need to put the other hand upon it, and then we need to interlock it, and then we have to compress the chest. It should be at least 1 to 2 inch deep, and the compression should be 100 to 120 per minute. And how it is how it will be done, like we will give 30 compression and 2 rescue breath. Then we will give 30 compression and 2 rescue breath, and we need to check for the chest rise while we are giving breath. The breath should be given by tilting the patient head and pinching their nose and tilting their head, and the breath should be given mouth to mouth. The breath should last for at least 1 second, 1 whole second. The breath should be lasting. Then we need to see if the chest rise is there, then we will be able to know that the person is getting our full breath. And then we need to 30 more compression and 2 breath, 30 compression, 2 breath for 1 whole minute. And then we will look for the AED. It is automated external defibrillator is present or not. If it is present, we need to turn it on first of all. Then we need to follow the prompt it's going to say. Then there will be 2 patches. First we need to put on the right side of the shoulder, and second we need to put on the lower left side. And if it is a shockable rhythm, we need to give the shock. If it is not shockable rhythm, we need to continue CPR. If it is a shockable rhythm, give CPR, and then we will give CPR. First we will give shock, then we will give CPR. As the emergency, then if the person is getting conscious, then we will put him in a recovery position and we will wait for the emergency. There are many causes of cardiac arrest, for example arrhythmias, trauma, MI, myocardial infarction, or drug toxicity, or so many drug toxicity and so many other causes. This is how we can save a life, and this is how a basic life support works. Thank you. This side Dr. Jagriti Thakur.